and welcome to Coffee with Marci. Women tend to suffer in silence when they have pelvic pain. However, 1 in 3 women have some type of pelvic dysfunction that can contribute to urinary incontinence, a weak core, painful intercourse, and more during the course of their lives, but are often too embarrassed to tell anyone. But now there is growing research to use physical therapy to correct these issues. Joining me now from Total Health Associates is Jennifer Collard, a licensed physical therapist, and marketing director, Stephanie DelMonte. Thank you guys so much for joining, coming on Coffee with Marci, and talking about such an important subject that so many of us are faced with. So Jennifer, let's start with you. Explain the pelvic floor dysfunction and what causes it.
Okay, so pelvic floor dysfunction is basically a broad term that includes lots of different kinds of issues that are including the pelvic floor and things around it. So I brought the pelvis to let everyone know about the different structures in the pelvis. So this is a pelvis. Here we are. Okay, so all of this white stuff here is bone.
Yes.
Okay, so this is your pelvis, where you put your hips like that, your spine, your sacrum, and your tailbone, your coccyx bone. These white things here are ligaments, sacroiliac ligaments. And then in the front of the pelvis you have your bladder, and then the uterus, and then back here is the rectum. Okay. So all of the red stuff that I'm going to show you is the pelvic floor, and it basically has about that 3 layers. A lot of muscles, different muscles and different muscle names, but I'll talk about them kind of referring to them in muscles, muscle layers. So the outside part here we'll call layer 1, okay? All of the red stuff here is muscle. So here we have the clitoris, the urethra, the vagina, this is the perineal body, and then the rectum. Okay, so this would be layer 1. These muscles, basically their job are to support the pelvis and the body weight and everything above it. And they help with continence and keeping the pelvic organs in your body. So that's layer 1. So here's the uterus again. I'm going to just take that out. And then here's the bladder and the rectum. Okay, we're just going to put those right there. So inside the pelvis is the layer 3. So layer 2 is in between layer 1 and 2, layer 1 and 3. You can't really see it in this model. So all this in here is layer 3, and this muscle group job is to really support and hold up all the pelvic organs. This is what people refer to when they're talking about the hammock or the pelvic floor. Right, so this is the bottom, and it suspends everything. So pelvic floor dysfunction can include anything that involves these muscles. The muscle itself could be tight or weak or unbalanced, and then anything that goes through this pelvis, the pelvic floor muscle, can contribute to a dysfunction. So in the dysfunction we have urinary incontinence, which could be stress urinary incontinence, like if you leak a little bit of urine when you laugh, cough, or sneeze. There's a specific kind called exercise-induced incontinence, and that happens when you're exercising. So it might happen in conjunction with stress urinary incontinence, or just by itself, only appearing when you work out hard. So there's also overactive bladder. So if you are having to go to the bathroom several times a day, or if you know in town where all of the different bathrooms are, you might have overactive bladder. So if you're doing a lot of just-in-case toileting, that could be an issue for most people. So there's also key in the door. So if you feel like a big urge to go to the bathroom when you pull into your driveway, or when you get the key into the door and you have this like rush of urge and you have to run, that falls under urinary urgency. There are also conditions like pelvic organ prolapse, when the bladder could kind of tilt into the vaginal canal, or the rectum can tilt into the vaginal canal, or the uterus might slide down. So those things can happen as well, and that can include muscle activation dysfunction, and then also pressure management dysfunction. So if you're lifting heavy things, or if you're a chronic cougher, those things can affect pelvic organ prolapse. There's also conditions like pain with intercourse, that's called dyspareunia. There's also vulvar skin issues that kind of go into the pelvic floor dysfunction term. And as well as, we'll see women with diastasis recti abdominis. That's when the muscles of the abdomen spread and there's a gap there. So all these things kind of are in the pelvic floor realm,
right?
Including C-section management
Yes.
after babies.
Unbelievable.
Yeah.
So what are some of the myths that surround pelvic dysfunction?
That's a great question. So one of the things that I like to let people know every day, and I say this all of the time, is that a lot of these problems are common, but they're not normal. Most women, a lot of women will say, I just thought that leaking a little bit of urine was going to be part of my new normal after I had babies, because everybody leaks. If I laugh really hard in the movies, I might leak a little bit.
Right.
So I want women to know that although it's super common, it's not normal.
No.
And then there's help out there.
That is really unbelievable, because
Yeah.
I too thought that was normal. And if anyone spoke to me about it, or, as moms, we're all sharing these things, I would have thought it was normal.
Right.
Right? The pressure from having the baby, things change, So this is really interesting. So there's even more things. There's more myths.
Right. So another thing is women and men think that Kegels will solve all of the problems. So if I leak a little bit, or if I have pain down there, if I just do some Kegels, I'll make everything better.
Yeah.
So that would be a huge misconception, because sometimes these muscles are weak and they're not strong enough to support everything. And that's common. And doing a Kegel or a Kegel type of exercise would be super helpful.
Okay.
However, sometimes it might not be the right thing. So sometimes women have a lot of tension, and tension and tightness doesn't mean strong. It just means tight. So if you had a tight muscle in your neck, you might need to stretch it.
Yeah.
So a tight muscle does not take load well. So if a person likes to run a lot, or do a lot of jumping activities or weightlifting, if their muscles are too tight to be able to give and move, that can be a problem. So,
and does it get tight from the exercising?
Well, sometimes it can get tight from the exercising,
Okay.
Or if there is an imbalance in the body. So it could be sometimes pelvic floor pain can happen just from bad mechanics. Like when people come in and they have hip pain or knee pain when they're lifting weights or doing a certain activity, I look at how they do that activity. So sometimes how people do their workout and lift or lift their kids is a huge factor in their pelvic floor pain. So it's not always tightening, and it's not always stretching, but it could be a combination of multiple factors.
And really the only way you could find this out is from an exam.
Right.
An internal exam, or...
Yeah, so sometimes it's an external exam if a person is not, wanting to have an internal exam, and that's always an option. However people are comfortable is what we do. So the gold standard is an internal pelvic floor assessment to see how well the muscles function, and if they are functioning well in the front and in the back and side to side. And then a lot of times women will do the Kegel incorrectly.
Yes.
So about 50% of women perform them incorrectly, and studies show that women do the best with individual feedback. So a lot of women will squeeze their buttock muscles or they'll hold their breath, and that would be an improper and sometimes a detrimental pelvic floor squeeze that can add pressure sometimes.
Oh.
Yeah.
So how do you know if you're doing it right?
So you could come in for a pelvic floor assessment, right, to a qualified pelvic floor therapist.
Okay.
And we could help you with that. There are other easy ways, like if we're all sitting here in a chair, and we're aware of our pelvic floor, so we can just tune into our pelvic floor and say, okay, I'm going to do a squeeze and a lift of my bottom and pull up and away from the chair. Is everybody at home doing that?
Are we all doing that?
Everybody? And now being aware of your bottom.
You know you are.
Yeah.
You have to.
So being aware of your bottom. So right now everyone's squeezing for their dear life.
Yeah.
Now allow your pelvic floor muscles to drop into the chair. So if you have an awareness of a raise, and then you have an awareness of a drop, that is a good sign that you at least know where these muscles are.
Okay.
Yes, we can't tell if they are, balanced on both sides or front to back.
Yeah.
And we're not able to tell if it's doing it in a speedy way to if you are going to cough or sneeze, you might say, oh, my pelvic floor has to work super fast to catch that.
Yeah.
So if your pelvic floor is slow on the contraction, it might need to speed up. So coming in for pelvic floor therapy is really useful in helping a woman figure out the things that she might just need to do a little bit differently.
Okay, and I heard you say men, so this is something that men and women are affected by.
Right, so men have a pelvic floor too. It's just a different shape. But men can have incontinence as well, prostate issues. So I currently am treating women.
Okay.
So unfortunately, I haven't taken enough continuing education for men.
All right, but if you are a man and you're watching this,
yes, there is help.
There is help.
You do not have to put up with it.
Okay. So that was an overwhelming amount of information, but incredibly useful. And I got to tell you, as a mom and talking to all moms, we all have some sort of this going on in some area. But one of the things that we were talking about earlier is when we go to the ladies' room, in a public ladies' room, and you were sharing, a lot of us don't want to touch, right?
Right.
Tell us about that.
So
it's important.
We were just talking about using a public restroom. So a lot of women will hover or squat over the toilet so that we don't have to touch the public toilet seat.
Yes.
So when we do that, though, we don't give the pelvic floor muscles a good opportunity to fully relax, to allow the urine to completely empty out of the bladder, right? So if these muscles are supporting the bladder and we're hovering or squatting, and these muscles are tight because they're having to hold us up in a squat, sometimes we can't fully empty the bladder.
Yes.
And then sometimes women will strain or push out urine to complete the stream, really. And that isn't good for the pelvic floor either, because then you're bearing down, and that is a lot of pressure on the urethra. Especially, and we don't want to contribute to any kind of drop or prolapse of the urethra or the bladder because we're straining.
Yes.
So ideally,
all right, ladies.
All right, so if it is a bad toilet, so you might choose to hover.
Yeah.
Right, but you might think about, if it looks safe, to layer up the toilet paper like a bird's nest, and make sure that it's covered, and then sit down and just relax, take a breath, and allow the urine to flow out instead of hovering and straining.
Okay, well that's good to know. And I do have a personal question, because my family tells me I go to the bathroom all the time.
Yeah.
Okay, all day long. If we're traveling, let's say, I'm going to the ladies' room, I swear to God, like every hour, hour and a half. Now I drink a lot of coffee and a lot of water. So what do you think?
So normal urination frequency each day is about 6 times during the daytime hours, and between 0 and 1 time at night. And that would be the normal. Doesn't mean it's common, so that would be normal if you're not drinking an excessive amount of water. So if you're going more than 6 times a day during the daytime and you're not downing a bunch of liquid, then you might have a little bit of overactive bladder or some urinary urgency. So also you mentioned caffeine.
Yes.
So there are different kinds of foods and liquids that can irritate the bladder and make you go more, so that can contribute to urge. So caffeine is one of them.
Okay.
I'm not saying to stop caffeine, but I'm just saying
that don't say that.
if this is an issue that is interfering with your life that you don't like, you might consider changing that. Artificial sugars, so like diet sodas, diet drinks, diet teas, anything artificial in the sugar category can irritate the bladder as well. And alcohol. Sorry. You didn't mention that, but that is a big one.
No. I bet it is.
So there's a list of different things that can irritate the bladder and make it have to go, because it's like, ooh, I don't like that, get out of here. So there's different lists that we talk about. So those are different ways to change behaviors.
Yes, changing behaviors. Sounds like we have a lot of work to do, ladies.
Sometimes.
That's okay. If you want a positive outcome, you got to put in a lot of work.
That's right.
That's what
knowledge.
I'm saying.
Knowledge is power.
Exactly. So, one of the things that has been discussed is physical therapy is common in Europe. But not so much here. Why is that?
So in some European countries, it's the normal standard to have physical therapy for 10 sessions or sometimes more if needed, after you have each baby. So they are aware that these pelvic floor muscles hold up a lot, and they've been through a lot. You know, it's not just if you have a vaginal delivery, a C-section has been through a lot as well.
Yes.
So if you think about your muscles going through what they go through being pregnant, right, expanding your center of gravity, your masses change, your balance changes, everything changes. And then whether you have a C-section or a vaginal delivery, those muscles have basically gone through a situation, or some people, trauma, and they need to be rehabilitated to regain their normal function. So if you think about if you were to have a knee surgery or a back surgery, it would be almost unheard of not to have physical therapy or some kind of rehabilitation to those muscles, so that you can relearn how to use them and to relearn how the function of them is supposed to come back, right?
It makes sense.
Yeah, it makes sense, and that's one of the reasons why I'm so happy to be here, is to let women know that it's common but not normal, and there's so much we can do to not have to have these problems. Yeah.
I mean, again, I'll go back to moms and us sharing and women sharing, and I had one friend, and she was a runner. And she constantly, while she was running, she was leaking the entire time. And it got to a point where she would just continue to run, right? Because there was nothing she could do. Well, there was something she could do, and she did end up taking care of it. But again, it's just not the norm.
Right.
And it's amazing to think that there is something that can be done about it. And I'm so happy you're sharing this with us. So thank you. Stephanie, I want to hear from you. What else does Total Health Care offer?
We are a multidisciplinary practice that serves the Waldwick-Bergen County area, and we have chiropractic, physical therapy, acupuncture, massage therapy, and nutrition.
Okay.
And our specialty, women's health, pelvic floor, PT. We really take pride in having all of these services under one roof because it really puts the patient first. It allows the providers to work together, and because our philosophy is total body care, whole body care, one part doesn't necessarily work without another, and the providers are always talking to each other, tweaking a patient's treatment. Sometimes one provider will have a question about a technique that maybe another provider can offer that will help their patient.
Wow, that's
so
great.
Most of our patients take advantage of 2 to 3 of our services and really have great results.
So they may come in for the physical therapy, but then these additional services would work together.
Yes.
Depending on what the needs are.
Right.
Yes. So me personally, I've always wanted to try acupuncture. And that helps in so many areas, right?
Yes.
So how does it necessarily help with the women and the pelvic dysfunction?
So acupuncture is a great way to help maybe bring the body down if it's tense, say, or if there's tightness. So it's just another discipline that can help balance out the system, because because with the pelvic floor dysfunction, we are talking about so many different parts of the body. We've got bone, muscle, fascia, ligament, organs, breath, posture, even the jaw and the throat, swallowing and talking volume can affect the pelvic floor. So all these systems, if there's a bad, not great link in the system, we can tweak it all together. And then we also just added Emily Navarro. She's our nutritionist, and she comes in super handy because we talk a lot about digestion and constipation or normalizing bowel movements, and she's been a godsend.
That seems that would be a big part of this also.
They all are. They're all interconnected, and they all have their different benefits.
Right.
Put together, it's an amazing treatment for a patient.
And so you don't need to go necessarily on medication. It sounds to me that these are ways to help yourself without having to medicate.
Oh, very much so.
Yeah.
Yes.
Yeah, so that's really important. I know that a lot of us don't want to put additional chemicals into our body. Yeah, so it's great to hear that. Now, how can we get our doctors to prescribe the physical therapy?
Education, re-education, really. They know that physical therapy exists, but we need to get them to talk to their patients about it and have them talk to the women they see every day and let them know that this treatment's out there, that it's they don't have to go home and just live with it.
Yeah.
It's just part of life,
Right.
just part of having kids. We are making a very concerted effort to meet with OBGYNs in the area.
Fantastic.
Letting them know what we offer.
Okay.
And a lot of it's because of our patients. They come in and they'll say to us, the first thing they say after their initial exam is, I wish my doctor told me that this existed.
Yeah.
I wish
Yeah,
I didn't have
absolutely.
to search the internet, or I didn't have to, jump through hoops to find this service if I had just known.
Okay.
And
Yeah.
the look of relief on their faces
Yes.
it really drives it home for us. And
Yeah.
it's why we are out here trying to get the word out.
Amazing. So if someone is watching this and they're about to have a baby, or they know someone that is experiencing these issues, can they talk to their doctor about it and have this prescribed?
Yeah, absolutely.
Definitely.
Yeah.
Yes.
Yeah.
Yes.
Yeah.
So that won't be an issue.
Yeah.
Now, does insurance cover this?
Insurance does cover it.
Okay.
It's no different than physical therapy in the insurance world.
Okay.
So most insurance plans cover physical therapy.
Okay.
And one of the benefits about being a small practice is that we are very, very hands-on.
Okay.
So if you call us and you give us your insurance information, we will find out what's covered, how many visits you have,
Okay.
and we really take an interest in our patients from day one till the
Yeah.
end. They call with any questions they might have. And yeah, it's really, it's wonderful actually.
And so how long does it normally take? Is everyone different?
Yes, everyone
Yes.
is different.
Okay.
But I would say within the first 3 sessions, people usually see a significant change in their
Okay.
symptoms for the pelvic floor dysfunction.
Okay.
So right away from day one, we talk about how they can manage their daily life maybe better by tweaking certain things.
Yes.
So that they go home with that information from day one.
Okay.
Because everybody is busy. We've got kids. We're working. We have family life. So a lot of times we don't have a whole lot of extra time to do all these exercises. So we attack it from but we work at it from function and what they can do in their everyday life first.
Okay.
And then we work on their specifics. And then we add, miscellaneous exercises that are relevant to what they are passionate about.
Okay. And these other things that are offered in the office, these are also covered?
Yes,
Yes.
very much so. Chiropractic care is. A lot of insurance plans now offer nutrition coverage as part of preventive
Fantastic.
care. Acupuncture care is covered. So, yeah.
That's wonderful to hear. I like the word attacking.
Oh, yes.
Let me tell you, I mean, you
Yeah.
kind of do need to go at this because, there's so many of us, again, that are facing these things, and just to know that there is a way to attack it.
Right.
Yes.
And
Right.
make it right.
That's right.
And make it right. So let's talk about the different treatments and that you would prescribe.
Okay. So first is a lot of talking. So the evaluation for pelvic health is very detailed because we're talking about all these different systems.
Yes.
So the talking part of the evaluation is detailed. So a lot of times I will give women a bowel and bladder diary to fill out.
Okay.
It'd be perfect if we had all that information for the first visit, but if not, that we do that so we can see what goes in, what comes out, and the time between that.
Okay.
So function and how they do the things that they do.
Okay.
So other things are maybe some exercise, right? Typically there's a lot of breathing going on.
Yeah.
So breath and how it loads and travels through the body is very important in its relation to the pelvic floor and diastasis recti. So we might tweak breathing or sequence it differently in how a person is moving.
Okay.
So we could do exercise and coordination of the pelvic floor. There might be stretching of the pelvic floor, so that would maybe entail some general stretching, maybe some yoga type poses if a person is into yoga, or we'll work it into whatever they like to do. Abdominal exercises. Biofeedback is a useful tool for some people. So biofeedback is a way of looking at the pelvic floor externally to see the coordination. So it's electrodes or sensors that go on the outside of the perineum and are attached to a computer. So when I ask the woman to do a squeeze and a lift of the pelvic floor muscles, we can see if it's working and if it's doing what she thinks it is.
Yes.
So it's great feedback for some women who don't have a great sense of their body.
Yeah.
So that's another tool that we use.
Oh.
And massaging, myofascial techniques, all those things we incorporate as are needed, whatever the person needs. And if I don't have the toolbox, then Dr. Jones, the chiropractor, he might have something to offer, or acupuncture, nutrition, all those things. So it's great that we have all this.
If someone comes in and they are having these issues, and you prescribe the treatments and all, but they feel that maybe you haven't discussed nutrition or such, if they brought that up and said that would be something that they were very interested in finding out about, could they do that?
Yeah,
yes.
Absolutely.
Okay.
Yeah.
All right, wonderful. Because it's good to have a voice, right?
It is. And there's never any pressure when they come in. It's not, we don't say, you have to see the nutritionist or you have to see the chiropractor. Right. But and a lot of times it doesn't come out until, a few treatments have gone by.
Yes.
If it's for the benefit of the patient, well then that's what we're there for.
Wonderful. If you're experiencing pelvic dysfunction, don't be afraid or embarrassed to talk to your doctor. There is help, as we've learned today. Please reach out to Total Health Associates if you think you suffer from pelvic floor dysfunction. They offer a free 15-minute phone consultation to answer your questions. Total Health Associates is located in Waldwick, New Jersey. Thank you all for tuning in, and we'll see you soon.